Do you suffer from migraines? Are you unsure about what a migraine is? Well, some of the symptoms of a migraine is a throbbing headache, nausea, vomiting, sensitivity to both light and sound, and lethargy. If you suffer from most of these symptoms, then you may have a migraine and may require some pharmacological treatment. An important part of diagnosing migraine is based on whether you have something called an aura. An aura can manifest as a series of sight disturbances such as dark or coloured spots, as well as stars. As well as this, the sufferer may also experience some of the side effects symptoms such as numbness, weakness, dizziness, speech and hearing disturbances, memory changes, fear and confusion, and rarely partial paralysis or fainting. Usually in adults these symptoms appear before the actual headache itself. However, they can appear alongside the headache in child cases. One effective treatment for migraine is Sumatriptan. Now, it's a part of a group of drugs called the serotonin receptor agonists, and they can be used to treat migraine attacks, both with and without auras. Migraine headaches are generally believed to be caused by dilation of blood vessels, and Sumatriptan works by constricting these blood vessels, thus relieving you of the symptoms and the headache.
Good morning, my name's Hilal, I'm the pharmacist. Could I speak to you about your medication?
Yeah?
Would you like to go to the consultation room?
Yes, please.
Okay. Can I just ask why you've been prescribed this medicine?
I keep getting a migraine.
Do you suffer from any medicine allergies?
No, not that I know of.
Have you had any heart problems like narrow arteries, chest pains or a past heart attack?
No.
Have you had any strokes or mini strokes? Any problems with the circulation causing cramps in your legs?
No.
Do you suffer from high blood pressure or are you on any blood pressure medication?
No.
Have you been on any other medication for migraines such as ergotamine, or have you been taking any medication for depression such as moclobemide?
No, I haven't taken no medication.
Okay, when taking sumatriptan you may experience pain or tightness in your chest. These may intensify but will generally pass on their own. If they don't, then you need to seek medical attention immediately.
Okay, I will do.
It can be a common side effect, but generally it's nothing to worry about. If you use sumatriptan frequently, it might make your headaches worse. So if you find they're not as effective, then go back to your doctor and they'll change the amount that's prescribed.
Okay, yeah.
Are you currently taking any medication for depression, such as lithium or St John's wort?
No. No.
Just note that whilst taking sumatriptan, medications such as these may cause side effects associated with it. Don't use any herbal remedies containing St John's wort.
Okay.
You might feel sleepy because of the migraine itself or the sumatriptan, so I'd advise against you driving, just in case you feel sleepy whilst you're behind the wheel. Did the doctor explain any of these side effects to you?
I don't think so. I'm not really too sure.
It's always best to check if you're not sure. The best time to take sumatriptan is as soon as you feel a migraine coming on, but you can take them any time throughout a migraine attack. They can't be used to prevent a migraine, however, so don't take them beforehand or while you're not suffering from an attack. Only take them as prescribed. If the symptoms come back after taking one tablet, you can have another one 2 hours later. The tablets can only be taken twice in a 24-hour period. If the tablets have no effect, or you've taken more than you should, then you should go and see your GP, or seek medical attention immediately. And you may suffer from side effects.
What are side effects? What are these?
Side effects are unusual feelings or experiences you may have as a result of you taking this medicine. Some are common and some are rare, but mostly they're harmless and minor inconveniences. You might suffer from an allergic reaction which may appear as a skin rash, or even something as serious as an anaphylactic shock, which may consist of wheeziness, tightening of the chest, or even collapse. If there is any reaction, speak to your doctor immediately. Some common side effects include drowsiness, dizziness, difficulty breathing, muscular pain, increased blood pressure, weakness, tiredness, or even nausea and vomiting. Very rarely, you may experience seizures, involuntary movements, tremors or visual disturbances. But you shouldn't worry about any of these. If you suffer from any of these side effects, either come to see me or go to see your doctor. That's not just the side effects that I've mentioned.
Okay, is there any like storage advice or anywhere I should store this medicine?
Keep the tablets in a cool, dry place and keep them out of the reach and sight of children.
Okay, thank you very much for that.
You're welcome. Remember, if you have any problems or you have any questions, come back to see me or go and see your GP.
Okay, I will do.
Thank you.
Alright.
Now, Sumatriptan might not be suitable for you if you have symptoms of cardiac diseases like chest pain or pressure in the chest area radiating to the neck, or if you're taking any antidepressants, or if you have intolerances to some sugars, or if you have reduced liver or kidney function, if you have a history of fits or seizures. Now, other warnings include if you're allergic to certain antibiotics known as sulfonamides, or if you're a heavy smoker and use nicotine replacement therapy. In some rare cases, patients have developed serious cardiac diseases after taking Sumatriptan, even though they have had no previous signs of it before. If there is a problem, tell your doctor so your heart function can be checked before Sumatriptan is prescribed for you. It should also be used with caution if you suffer from diabetes, so make sure to check with the pharmacist before buying Sumatriptan or with a doctor before you begin your treatment. And, of course, make sure to ask your doctor or your pharmacist if you're unsure about anything.
Remember, you don't have to suffer from migraine in silence. If you are suffering from migraine, go speak to your GP and pharmacist and seek medical advice about it and see if Sumatriptan is good for you. You may be suffering from migraine if you have throbbing pain, sensitivity to light and noise, and if you have confusion, problems with memory, weakness, dizziness and drowsiness. In these cases, you can go and see your pharmacist or the doctor and seek medical advice. And basically, Sumatriptan it works by constricting the blood vessels, which is thought that the cause of migraine is basically the dilation of blood vessels in specific parts of the brain. And Sumatriptan basically works by constricting these blood vessels, and it recovers the pain. It should be taken once you start feeling the symptoms of migraine. You cannot take this medication for prevention before you feel the symptoms of migraine. But once you start feeling the symptoms of migraine, you can take these tablets. You can take one tablet, and if it doesn't recover the migraine, you can take the second tablet, leaving 2 hours gap in between. But if 2 tablets don't recover the migraine, don't take more than 2 tablets. In that case, you can go and speak to your GP about further medical advice. In case if you have taken more than 2 tablets, still you can go and seek medical advice. There could be some side effects to Sumatriptan, which are drowsiness, dizziness, wheezing, rise in blood pressure, and muscle pain, and very rarely some rashes, skin rashes. In that case, if you feel some side effects, still you can speak to your GP about it or the pharmacist to seek medical advice. Thank you very much.